Okay, good morning. We're here this morning with Miss Ann Berry, and you started coming back in this summer, and kind of give us a little history of what was going on with you, and what you've been through, and what kind of problems you've been having, and what we've done about it.
Okay, I came back in early part of the summer. I was having problems with the lower back. That's where I thought the pain was coming from. And then after several weeks, I started telling you about I was having problems with the numbness in my arm. That went on for a couple of weeks, and I went to my medical doctor, and they did an x-ray, found out I had spurs on the nerve. Then I went back and I had an MRI. And then I came back to you, and I was still complaining about the numbness in my arm going all the way down to my fingertips. So then you decided, well, let's go a little bit further and go to the decompression table. And I was in so much pain to trying to even do the decompression. It was just severe pain with me going through. After we started that, I guess a couple weeks, I started seeing some results. You kept saying it was going to get better. I just didn't see it. Just didn't see it at all. I continued with the decompression, the machine on that. After that, I could tell I could raise the arm a little bit more. I could put some pressure on the arm a little bit more. I still didn't see the results, but each day I stuck with it because I had no other results. And now I can truly say I can raise the arm, I can put some pressure on it. I wouldn't say I'm completely out of the woods. I know I'm not, because I still have a long ways to go, but I am much better in what I was. And I really think the decompression machine really helped me. That's what saved me.
Okay, so let's recap that a little bit. And basically, you've been a patient a long time. You've got a bad scoliosis,
yes,
and most of the time your problem's in your low back. This past year, you started having some pain going down your arm. When we did an MRI of it, when we got the MRI back, it said you had a disc herniation that was putting pressure on the nerve that's going down that arm. And so the last time you went to the medical doctor, you know, tell us about that, and tell us what kind of options he was going to give you.
Okay, I finally got an appointment with the medical doctor, pain management doctor, and I thought I was going to get better results from him. I didn't know. I thought he would give me a little bit more confidence. He suggested shots in the neck. That was one option. He suggested steroids. That was my second option. And then he suggested some kind of, it was just, I guess, mostly painkillers that I could not take during the daytime. I only had to take them at night because they were so strong. Okay.
And so he basically suggested different types of medications.
Yes.
Nothing that really addressed the problem, but kind of covered up the symptoms. Mm-hmm. And then what did he tell you? If those things didn't work, what would we be doing?
He looked at me and he said, if those things didn't work, before he said if those things didn't work, he said, seemed like what I'm doing now is going to my chiropractor. I'm getting good results from that. So he looked at me, in which I thought he was going to say something. Then he said, told me to continue what I was doing, and that was going to the chiropractor.
Right.
And I went, you know.
But if that didn't work, he basically told you that you needed that you'd be a surgical candidate.
Yes.
So basically,
yes,
when we look at your MRI, you are definitely somebody out there. If you went to the neurosurgeon, they would do surgery on you.
Yes.
Okay.
Yes.
So he told you that was your last straw. So, but because of the cervical decompression that we started working with you on, basically we've averted surgery. Yes. At this point.
Yes. So
how much improvement would you say, you know, from when you were in the most pain going down your arm in the middle of the summer, how much improvement would you say that you've had since then?
Since the pain started up to now, I say the most improvement has got to be at least 95%.
95%.
Yes.
So you just got a little bit of lingering issues, yes, still going on, and we're continuing to work on those. But yes, overall, basically we've saved you from having to go through neck surgery, mm-hmm, you know, and we're getting that pressure off the disc. So if anybody out there that was, you know, skeptical about coming into our clinic or skeptical about chiropractic, what would you tell them? What would be your advice to them?
I have told so many people at this point now that you was the one that really helped and saved me, because I just didn't see it. I would give them, somebody would ask me about it 100%, to come in. They'd probably be the same way I was, that just don't see it, but give it a try before they say no, it's not gonna work. I would say absolutely give it 100%. Just give it all you have and just let the doctor do what he need to do, and you just come in and you will see some results.
Okay, so you'd recommend them coming in to see us and let us at least take a look at it and give it a try before you went to surgery.
Right.
So thank you today for giving your testimony, Ann.
Thank you.
Okay.
How did I